Let's go. So this is our new plan for excellence. We just revised this last year. It was a rectangle or a square previously, more of like a plus sign actually, but now it's a circle, which we like. Circles are cool. It ties in a lot of the same priorities that we had as an organization before, but I think what is worth pointing out here is that a lot of the work that Brendan and I have been involved in and the organization has begun to prioritize is found here. So it's baked right into the piece, the document, the reference point for everyone across the organization on a daily basis. So promoting a healthy workplace, respecting all people, raising the bar, building trusting partnerships, but the new mission statement. So together we advance the health of our communities. I get super pumped about that because it really feels more like the direction that healthcare should be traveling, in my personal opinion. And I should say that I have no clinical background or experience whatsoever, but it feels like we're going to actually start providing health care rather than just helping people stay sick in kind of a tolerable way. You got anything to add about that?
Not too much. The new symbol kind of looks James Bond-ish. So.
It does, GoldenEye.
Yeah.
So we touched on this, the mission statement, together we advance the health of our communities. Again, that's kind of old hat for Brendan and I. That's a lot of what we've done and what we've talked about. I've been here for 10 years. How long have you been here now? 4?
I've been here for 4 years.
4 years. But it's new and it's uncomfortable for a lot of folks who have operated in the healthcare sector for a really long time. It's a lot different than providing sick care.
And I think one good thing to mention about this though too is the reason why, am I allowed to? Okay. The reason why this mission statement changed in some ways is because of some of the work that Grant and I were doing. So if you're talking about institutional change and engaging with your leaders in different ways, you may not feel that your work has a super amount of relevance, but something like this is kind of where that work kind of paid off into baking it into our mission and really kind of changing the way our healthcare system is looking at it. So it's just kind of one basically avenue that our work has then turned into.
Yeah, in a lot of ways it feels like the culmination of all the work we've been doing for the last decade, which is awesome. It's a really neat feeling for it to be recognized organizationally like that. And we're good on the volume up here?
Yes.
Sweet. Values, again, more boring mission statement stuff, but promoting a healthy workplace. And that really, I think that's the heart of what we're doing and what we're talking about and thinking about on a daily basis. Brendan, in terms of a safe, environmentally friendly environment for sure, and thinking constantly about the products that we're bringing into the organization, to the walls of the hospitals, and how we're handling them on the way back out. How do our employees interact with all those things? How do all those things interact with the environment once they leave the walls of the hospital? And we expanded our team recently. We hired a couple of new employees. Their job titles are Healthy Living Coordinators, and they are tasked with largely education, but really promoting a lot of the resources that exist within the walls of the hospital that are rooted in some of this healthy food, healthy environment kind of work that we've been doing for the last 10 years, and really bringing that to the employee base. We're the largest employer in Southwest Michigan, in the second least healthy industry in the nation, right? So we're not super good at taking care of ourselves in the healthcare industry, but there's no really good excuse for that. We have endless resources, we're huge employers, we play a significant role in all the communities that we serve, and helping our employees, our teams understand and recognize that is, we believe to be very important. So Rob and Paige, they're busy today, so you might not get a chance to meet them, but that's what they're doing. They've been formulating their strategic work plan for the next 3 to 5 years to bring all of these resources to our current employees and identifying the needs and wants and desires that our employees have for how they can engage in their own health and hold themselves accountable for their own health. We make a lot of assumptions too, and we have historically, and I'm sure we'll continue to make a lot of assumptions about what people need and want. We haven't done a really great job of asking what people actually need and want and identifying what the true barriers are standing in the way of somebody getting or staying healthy.
And I think one of the big pieces, being a lot of nurses in here, we hear that nurses are really good at taking care of other people, but in some ways not really good at taking care of themselves. And we hear that over and over again, and I think what our thought process is, especially with Rob and Paige and the work that we're doing, is how can we get our employees to take care of themselves first, so then they can better take care of our patient population. So a lot of the metrics and everything that we're looking at and tracking kind of are the general, patient care metrics that we're seeing throughout the organization, because the better our in our minds, the better our employees are taking care of themselves, the better actually our healthcare will be. So, but
I do. I
yeah.
have something to add to that,
Yeah,
which I
feel free
think
to,
maybe, I don't know if the connection's been made, but I think when it comes to, because right now legislation wants to do the Safe Patient Act, the Safety Act.
Mm-hmm.
And I think when we can get numbers down on the floor, and the nurses and, on an oncology floor and not taking care of 5-6 patients,
Yeah.
when they should be 4.
Right.
I think has a lot to do with them. You have these 5-6 individuals' lives in your hand for the next 12 hours. And some of them are,
Are you okay?
That was much more sad.
Step up like this.
this is gonna make for a great video.
So,
Can't follow that.
so what you bring up is absolutely what Rob and Paige have identified as a really relevant point of interest. So they've talked about rounding and asking those questions because the patient load, for sure, the ratio is of utmost importance.
That
But
tends to be more institutional. That's like an institutional change that has to happen.
absolutely, and ensuring that, so if your staffing levels are appropriate, then your ratios can be appropriate, and people can get breaks, and they can walk away, and they can relieve themselves and go eat a meal. I mean, we spend so much time in the food and nutrition department alone devising like grab and go things that people can take away, because we recognize that they don't have 15 or 30 minutes to sit down and eat, which it sucks, but it's essential, it's necessary.
When I started at a particular institution I thought was pretty good, they had a snack cart come up, and employees were allowed to get, some of them were quite healthy snacks, but if you could stock it with healthy snacks.
Yeah.
I mean, it's just a little thing. I know, institution will be like crunching numbers and stuff, but that's the kind of thing that you need to keep people healthy, because when you're stressed, you go for those comfort foods, right?
Yeah, totally.
And then there's no reserve there. And then you have unhealthy people trying to care for other individuals.
Yeah, and we should definitely go off on that tangent this afternoon when we're talking about food, because there's a lot of ways to demonstrate success if an organization is willing to take risk on healthy foods.
And we're definitely seeing a lot of that too, like Grant's point earlier when he said that we are, we'd love to have a group like this of Bronson nurses and nursing staff in a room, but trying to get someone for a lunch and learn even, or any of those activities. I mean, we have a lot of great services and a lot of things that we want to talk to our employees about, but until they have the time or even the ability to get away and kind of take that next step, it kind of makes it difficult for us to do our jobs and then for them to do their.
Well, I'll tell you, there's legislation now for the Safe Patient Safety Act or something like that they're trying to hit. Michigan, I know out west, out east, there's a couple of states that actually have put numerical ratios, state laws that hospitals have to adhere to. So that would be a start.
Yeah.
I guess I always assumed it was a law. I thought 4 to 1 was is that just a generally accepted maximum, or recognized as appropriate?
I remember they have specifics, like each floor has their
It
own
depends on
floor
specialty.
you're on.
Oh,
So
like an ICU would be.
1 to 1 or 2 to 1, depending on where mom is, and then if you're going to have a med surge, it could be 4 to 5 to 1.
Mhm.
But some of them push 6, and that's just.
I know some are 8.
Yeah, I was gonna say someplace.
8?
Depends on the time of day also.
Holy smokes.
But if you're supposed to hourly round on your patients, and you have 8, you can do the math. It's not much time to each.
Yeah, that's assuming
Break time there.
if even one is high maintenance, you're in a bad way, right?
Yeah, so look
Yeah.
at mother baby, so you have, it's basically a couplet, so you have mom and baby, and at one point it was, so you'd have 8, so you'd have one nurse.
16 patients,
Yeah.
because the baby is his own patient.
So there, you can start there too.
Yeah.
That's what nurses are.
What-
You know?
Yeah.
It is. That's
It wasn't very a solution, it was just more, problems.
Well, no, but it's spot on, because it's our single largest group of employees, right? And probably the most taxed group of employees from a physical and emotional standpoint. This is our service area. It's not a super exciting slide.
It's where the stars are, is that?
Yeah.
Yeah, these
Yeah.
are our main hospitals. where our hospital's at, but we have numerous outpatient facilities and things like that.
Yeah, what's the total number of, I think we operate something like 60 facilities. They're not all
I
clinical.
thought it was
but-
more towards 90,
So
but it
what's the
might
one in
be.
Calhoun then?
That is
Bronson.
Battle Creek.
Oh, okay,
Mhm.
okay.
We have a hospital in Battle Creek, and then we have a couple other interesting facilities, like a long-term, like almost elder care facility.
Yeah, 100-bed long-term and rehab.
Mhm.
Yep, which is really beautiful.
And our athletic club and a few other facilities that are kind of just throughout the different counties.
Some stats. So I mentioned we're regional, not-for-profit, locally owned. Largest employer, that number actually might be a little higher. This is the most recently updated slide deck I could find anywhere. I think we're closer to 9,000 employees at this point, but the largest employer in Southwest Michigan, 4 hospitals, beds, yada, yada, yada. A little bit more. This one's really incredible to me. I think the Bronson Battle Creek Hospital in particular, I think boasts a volunteer team of over 400. I mean, it's just bonkers the number of jobs that volunteers are taking on. Yeah, it's really incredible.
Does that include all the dogs that?
Doesn't say people though.
Yeah.
That's what I used to volunteer to do in high school. I took around the dogs. It was really tough work.
They have their own IDs and everything.
I just have this vision of a dog posing for a headshot with a badge.
Oh, Chris.
So this is our sustainability timeline. This represents roughly the last 20 years of sustainability work. I'm going to hand it off to Brendan because he is far more adept at speaking to this than I am.
So this it ends in obviously 2008 right here. It's a little hard to see. We have a couple of these posters throughout different areas. One in our executive's office that Grant and I work for. So this was one thing that back in 2008 that he requested. And so if it's a little thing like creating a poster or, developing that story, this helps engage that leadership even more. We developed this in obviously 2008, but then he's been requesting for more and more updates of this and to, keep it relevant and keep it moving. So I believe our corporate communications department is in the process of refreshing this up to current day. And it's just another tool that helps engage patients, it helps engage our leadership, and even using presentations like this or other presentations throughout. But it all kind of started, our sustainability story all kind of started with, I believe, when we went mercury free. So there was a couple legislations that passed where trying to get mercury thermometers out of health. And I've kind of helped other organizations, including like Sparrow and some other hospitals, to use this work and presentation that I was able to do as an intern and then kind of take it to their organizations and also kind of hopefully justify more positions. Because there's a lot of research and things that you have to do in order to just kind of stay relevant on some of these subjects. And even one of the big points with energy is you just have to keep up on with it so often that if you kind of let it lax, you can really miss out on a lot of savings and things like that too.
I think it's worth, so you touched on this for a second, but I know you're supposed to walk away from this 50 minutes with a couple of ideas, right? And you can, Brendan mentioned the messy work, and you can put together a hodgepodge committee, group of people from all sorts of different departments who express an interest in sustainability or healthy food or whatever. And you can that can get you so far. You can use zero resources and do committee work and really rally the troops and the champions throughout the hospital to get you to a certain point. But once you reach that point, to really get to the next level, it's critical to have a point person. We went through the same learning process with our healthy living coordinators and the employee wellness programming. We had a hodgepodge group of people who were interested in it on a personal level. They got a decent amount of stuff done with zero resources, $0, and then kind of hit a stopping point. And to really escalate it to the next level, we worked diligently for 2 or 3 years to find a way to justify these roles that we now have, to do the research, to tell the story, to to stay in front of the organizational leadership and celebrate the things that have happened in the past and to explain the rationale for things that you want to have happen in the future.
Yeah.
So this is I know we used this slide last year too, I think, but this is extremely important. I think the work that Brendan and his former boss did to put this together and justify that position, it's a really valuable learning lesson. So this is something I would point to for sure.
And again, this is something that we're definitely willing to share too. So if it's even at your organizations or it's something similar for justifying a position, other organizations have used this. I've gotten a couple calls from out-of-state hospitals like in Florida and Colorado and things like that who wanted to kind of justify something like this and have a one-pager. It's a one-page document that you can set in front of someone and say, this could justify a potential position, and make something happen.
It seems so obvious too. Like it's just writing a really basic business plan. And the more I talk with Brendan, the more I learn about the things that we've done and the things we could be doing. I mean, to justify the return on investment for a single position or multiple positions, it does not take a lot of initiatives. There's so much opportunity to save money or find money out there. Sometimes it's just a matter of kind of brain dumping it all on one flow chart and handing it to the right person.
Being such a large organization, I mean, talk the patient to nurse ratio, the sustainability coordinators and sustainability and healthy living positions to staff is, I mean, pretty low, and the ratio is pretty large. So adding a couple other positions is, with the amount of square footage we have and things like that, it kind of makes sense. So we'll kind of jump back.
Yeah, and that led us to this. So this is a part of our, and this is still sort of in a draft format, so let's acknowledge that. But this is kind of our brain dump around healthy living and sustainability. So this captures a little bit of what we've done. These are some of the programs that we have in place. You'll see a bit of the Healthy Living Campus, some of the initiatives that we've committed to. Seneca is a great example of something that is on that timeline that we point to a lot as a demonstration of our commitment to the local economy and the work that the sustainability initiatives and our local sourcing initiatives have yielded, bringing this large supply distributor to Kalamazoo, creating jobs. Environmental sustainability, these are, again, some things we've worked on or will be working on. Brendan, I'm sure, will talk about greening the OR at some point. Our partnership with Stryker on some of this stuff, green building design, and where we want to go in the future. And then housing and mobility we'll talk about here in a little bit, but those are two of the places we're really hoping to go with our sustainability work because, as you saw from the revised mission and values, we're beginning to look outward more than we have in the past and really start to embrace our community and recognize that housing and mobility can have a positive impact on our employee base, but also on the community at large.
And one interesting piece that I'd like to point out is the at the top here. So the top, we've been working with the new Healthy Living coordinators. We kind of wanted to figure a way, how can we take their work, Grant's work, and my work, and kind of combine them into one. And so we kind of came up with this almost mission statement of our own, or
purpose, we call it purpose.
And so it says creating an environment where people can flourish. And we kind of wanted to, we were mulling it over a lot, but we wanted to come up with something that was broad enough and was kind of generalized enough that it could kind of encompass all the work that we're doing, but then also keep us on track to be on the same page.
Yeah, it gives us something to point to as we do all this work, right?
Yeah.
Like, is this project that we're talking about right now, does this help people live healthier lives, be happier?
And so if
Be
we can
less
take
stressed.
something like that and bring it to leadership or bring it to different parts of, nursing or physicians or anything like that, it can kind of help guide us, but then also kind of say what we're trying to do. So this is our old guiding principles. So kind of we took this and then turned that into that poster almost, where we had our pegs, which were the energy conservation, green building design, sustainable food, and then I believe waste was one of them. Oh, pollution prevention was one, which waste was in.
So just an example of formalizing the informal and taking it to leadership.
Yeah. So taking a formalized document where you could have your CEO, you could have someone sign off on it and say, this is, as an organization, this is something that we would like to look at. And then also with the reporting structure on how that reporting structure of those initiatives and things are going to go back. And over time, it's developed in different ways. But always having that reporting structure where, so then people are aware of things that you're doing or the work that the green team's doing or anyone that can be aware of that work. It's pretty important. So this is the our HHI checklist. I just kind of threw this in. And then this is a picture of our Bike to Work Club and Grant biking into work. But these are kind of just the checklist of kind of the boxes that HHI is. I think it's just HH now, not HHI, but it's the Healthier Hospitals Initiative. It used to be. I think it's Healthier Hospitals now. But this was kind of it's a good free resource where you can, if you're just starting on from a sustainability standpoint, it's a really easy to use free resource that can kind of give you, this is a leadership challenge that you can just check off boxes to how you should engage leadership in different ways. And it's all online. And this was kind of our check boxes of what we're doing. So this is one resource that I would suggest, if it's something that you're interested in and kind of want to pursue, taking a look at this and saying, what are we doing, what aren't we doing, and using it as almost a guide to move forward.
I'm glad you said check boxes. I kind of hate checking boxes. This is a useful tool, obviously, to developing something, but I think what has allowed us, one thing in particular that has allowed us to be so successful in this organization with this work is that we don't do it to check boxes. We talk about the local economy a lot, really more and more today than ever before, and the role that as an anchor institution we play in the overall health of our communities. So this work that we do, it's not about saying that we buy, hormone antibiotic-free chicken from Tyson. It's about how do we develop a local network for thoughtfully, appropriately raised chicken that not only we can benefit from, but that ultimately the community at large can benefit from, because that infrastructure has been built and it's a broader network of small farmers who are doing the right thing. Same thing with mobility and housing, right? It's not just about saying we're committed to alternative energy vehicles. It's about how does our commitment to electric vehicles or bike to work or the metro bus transit infrastructure, how does that help our employees and the community at large reduce their household expenses and live healthier, happier lifestyles, right? Mm-hmm. So we point to the economy more than we ever point to winning an award or checking a box or getting a certificate or anything like that, which makes the work that much more relevant, meaningful, and enjoyable, frankly. And relatable to the executives. I mean, it's a much easier story and more compelling story to tell to your CEO.
Then you win some award or something like that.
Yeah, I guess if it's the right CEO.
Yeah. And one more second on that. I think speaking anyone's language is kind of the best way to go about. I mean, from a communication standpoint, if you're talking to your CFO, speaking money is the number one thing to go. And I think Grant and I know our boss, or Grant's boss, pretty darn well, where we can speak his language on what he's passionate about and what he wants us to go after. Mm-hmm. So almost if you're going to talk to your, chief operating officer or someone like that, really speaking their language and finding, what part of your work and what kind of, what part of sustainability or, healthy living or anything like that really drives them. And then when you can take that and if it is awards or something like that, maybe you can talk about the award piece or, what really drives them, and then kind of take that portion into those.
Make it relatable. So, how are we doing? Good? Questions, thoughts, feedback?
I had a question just about the biking, the bike to work.
Yeah.
Because I don't know this area well enough, do you have good, safe bike lanes, and how do the bikers get along with the car drivers? We had someone killed recently in our community, and I'm part of the biking community, and it's devastating. And there are some areas that are very scary to ride your bike in, which I don't go to, because purposefully people try to run you off the road.
Yeah, that's, so that's happened here recently in it happens,
Well,
I'm sure, in every community, right?
Last year?
Yeah, last year.
Yeah, it was- and that terrified bikers throughout the state.
Oh, yeah, and that goes on, it got a lot of attention here, but it happens everywhere on a daily basis. Yes and no. So we have an amazing network of trails in Kalamazoo, but they're paved trails and they consume huge dollars and resources to build. We have bike lanes. We last year I think passed a community, what is it? You call it an initiative. I don't know if it's a law necessarily, but when a car passes a bike, you're required to give 5 feet, even if they're in the bike lane.
Was that a state budget?
Was it state?
I think it's state.
Okay.
And we've been passing a lot of local legislation around complete streets policies. So including our Imagine Kalamazoo, which is going into our master plan as a city. It's all that complete streets policy and a few other things sustainability related are kind of baked into that.
What's what?
So there's a lot of
What's complete street?
it's basically like a holistic approach at street operations. So making streets and the streets in general good for pedestrians, bikers, like all modes of transportation. Really thinking about everyone rather than just cars, even public transit and things like that. Thinking about the whole system rather than I need to get this car to this place and things like that. So there's a lot of communities now that have a complete streets policy, and Portage and Kalamazoo are one of them now, where whenever we have a new road or any federal money or anything coming in, it's all kind of put through that policy, and we have to make sure we have certain things for like biking infrastructure and stuff.
And as an anchor institution, and we have some mobility slides in a minute here, but we've learned again that we play an essential role in that work, because we start talking about biking or busing or anything related to the largest employee population in any community. We're at the table, that we get invited to the meetings, at the city council meetings and the working groups around the city master planning and things like that. So because we've raised awareness within the walls of the hospital executives that are sitting at those tables, it's top of mind when they're having conversations about, do we want to transition one-way streets to two-way streets, and do we want to move bus stops? How do we want to handle our traffic signals and stop signs and things like that? Road dieting, sidewalks, yada yada.
And being a large employer, if we can get one more employee to just ride their bike once into work, or just on the weekends ride their bike, or go out and basically walk around downtown or things like that, and just experience doing things differently, living a different lifestyle. I think that almost brings more awareness to them. If they do see a biker on the road, if they see someone walking or running, or out in general, they might have a little bit more compassion and kind of help create that community change too, which I think people like the bike lanes, but if someone wants to cross that line, someone's going to cross that line. So really bringing that community change.
I have a question also. I heard that healthcare is the second least healthy industry, I guess. Two questions. One is, what's the first least healthy, and what are the measurements that you're judging that by?
The first one I can answer for sure. The second one, it's just a thing I've been spouting for 3 years. I'm not even sure if it's true anymore. Casinos. Casinos are the first least healthy. Yeah. And then the rest of it, I presume, is based on whatever standard health metrics, BMI, blood pressure, things like that. Yeah. So the first one I know the answer to definitively. The second one was just, we kept reading that in studies and started, that's probably why largely why we have the healthy living coordinators, actually, because we said that enough times to our leaders. So fun graphic that we have been using recently, we talk about this in terms of the work that we're doing in our healthy living and sustainability department, really being in the sweet spot of this Venn diagram here in the center, and ensuring that all the work that we do, all the initiatives we take on, the programming does positively impact our local economies, creates social equity, or at least fuels social equity, and has a positive impact or less negative impact on the environment. A lot of graphics. Man, people love PowerPoint slides, eh? These are a few of our initiatives and a few of the reasons we're taking on some of the projects that we are. This is how we talk about using our built environment to drive forward some of the healthy living work. As an organization, we are committed to reducing parking demand on this Kalamazoo campus by 1,000 parking spaces. And truly, that's to avoid building a parking ramp. It's the worst use of dollars, lowest and worst use of land. Also, they're just ugly and annoying, and it doesn't do anything to discourage people from driving. So, reducing parking demand. Right now in Kalamazoo, better than 50% of the city parcels are tax exempt. Yeah, here we are as a nonprofit hospital whining about that. But we actually pay a significant amount of tax on all the things that are non-hospital use. And how do we assemble parcels of land as a anchor institution and work with developers to turn those into taxable properties, ideally taxable properties with affordable housing and not parking lots. Back to complete streets and walkability, creating an environment around our hospitals and throughout our downtowns and our communities that allow people to walk rather than drive, that create urban density to the point that you can justify a business plan for a grocery store, things like that. All the community amenities that somebody wants and needs that makes it appealing to live close to where they work. Affordable development is a key component of that and is proving to be the most challenging, but we will not give up. Yeah.
And some of that kind of comes from, I believe it was a study that New York was one of the healthiest cities, but some of the bigger cities are more the healthiest cities, just because people are walking so much. I mean, there's things like noise pollution and unsavory things about larger cities, but I think the walkability and the ability to get to different services and resources is really nice. And as a smaller city, how can we, take away some of those negatives, but also get a lot of those benefits, like the walkability, just the building of the community in general, and then being a downtown hospital. We're definitely in that core.
Yeah.
Core Kalamazoo.
And I don't know to what extent the organization played a role in this happening, but Kalamazoo is the beneficiary of has been the beneficiary of many significant philanthropic gifts over the last few years, but one in particular last year was this Foundation for Excellence, which was a $70 million gift intended to bridge the city's financial gap and afford, I think, $10 million a year for what we call aspirational projects. But as a part of that gift, there was a leveling of millages. So what has happened in years past is it's obviously much less expensive from a tax standpoint to live in an outlying area than it is to live in the city. Our millages are higher. So we were at about 19 mills in the city of Kalamazoo, and all the outlying areas, Portage, Oshtemo, the townships, were at like 10 or 12. So when this gift was given and the commitment was made to use that as seed money for a $500 million endowment, we leveled all of our millages. So our mills in the city are now 12 mills, which is a part of, but it's helping to build that urban core. How do we make it as affordable and appealing to live in the city as it is to live 10 miles out of the city? So all of that to build a sustainable urban core and hopefully lead to healthier people, happier, healthier people.
So this is our kind of part of our mobility initiative. Obviously, again, reduce the parking demand by 1,000 parking spots. And then our Bus to Work program has been a pretty new thing that we've been slowly growing. We grew from about 307 rides to 1,200 rides per month, where we offer free bus passes, which Grant and I both have on our badges here. That basically any Bronson employee can come to our office, qualify for it, and then ride the bus for free. And this has been a pretty easy to implement program, but we've seen a lot of satisfaction from our employees where they're not paying so much if they already rode the bus, or a lot of people who can get rid of a car and not have to worry about a car, or their car breaks down or something like that. And we're seeing even some employees, their car breaks down and then they just ride the bus from now on. So trying to slowly create that culture change around taking public transit. It's difficult, and we've had a lot of challenges with our public transit here in Kalamazoo. So I think another big part of this is it gives us a seat at the table. We're a player with Metro Transit now, and they listen to us more and more if we want to create a new stop or kind of help them create a better service for our employees and for the people of Kalamazoo. So it's kind of, it's helped our employees, but it also has given us a seat at the table, which is kind of nice. Yeah, and so to try to consolidate some bus stops and routes and things like that. And Grant and I, for I believe it was like a month or so, where all we did was just ride the bus to meetings, to, from home and everything like that. And there definitely are some challenges, and I think in mobility in general, it's there's a lot of challenges, and everyone likes their single occupancy car, and trying to change that paradigm and move to something else is kind of difficult.
So back to ideas that you can take back and implement, low cost, high impact things. This is an example of what did Mike the other day, Mike is my boss, he said, proceed until apprehended. But this is something that we just carved out of the food service budget, right? It was a conversation that Brendan and I had. What we're finding also is that a lot of the opportunity to have the most significant impact in terms of health and sustainability lies within our lowest wage earners, our entry-level positions, food nutrition services, environmental services, things like that. These are folks who are paying, they're shelling out $60 a month to take the bus. Now they're saving $60 a month, right? It takes one person, one of those like 90 plus people we have signed up for this Bus to Work program, to tell that story to the right person, to send Frank, the CEO, an email, and this has happened. And all of a sudden, Frank references this on a routine basis. He's brought it up twice in meetings, community meetings that I've been a part of, where he says, this group just said, all right, this is going to cost us $1,000 a month. It's a $2 billion organization, right? This is $1,000 is nothing. You can sell some more apples and make that money up. But it's having a profound impact on the lives of almost 100 employees. And this 1,300 rides a month equates to about, it's dropping the 1,000 parking space bucket, but about 30, 35 cars that are not coming onto campus. So it's a step in the direction of achieving that goal. The FIDO thing here also that Brendan, I think, did you mention this? This is a local company in Kalamazoo who's manufacturing custom-built electric, 100% electric motor scooters. So they moved here from Seattle. They start their frame up, they're welding these things in Kalamazoo. And Bronson bought the first one. I think we're probably going to buy the second one too. But it's a local manufacturing business, bringing jobs back into the community. They refurbished, rehabbed a huge industrial building in one of the highest risk neighborhoods in Kalamazoo. They're employing people, they're generating revenue, generating tax dollars, so there's a lot of wins in there.
And one interesting thing about our Bus to Work program too is we, at Western Michigan University, the big university here in Kalamazoo, they pay about, I think it's right around $400,000, $500,000 a year for any of their students to ride the buses for free. I think it's similar for Grand Valley and other universities who kind of do similar programs where you just have your ID badge and you ride the bus. What we really wanted to do is we wanted to be able to track those employees in some way so that we would know how many rides are we actually getting, what impact are we actually making, is everyone actually riding it? And then it also allows us to we pay a lower amount per month where we're actually paying per ride then. So instead of just shelling out a bunch of money and saying this is what we want to go with, we wanted to kind of track it more on, we're paying a per ride and we're engaging in them in different ways, and the more they kind of work with us to grow our program, the more revenue they will get from our employees too. So we're kind of in a partnership rather than just saying, here's money, we want this service, and then now they have some kind of skin in the game too. They know the more and more employees we grow and the more people they let know and everything like that, the more we can actually make this program successful.
10:50, is that we done?
You're over by 10 already.
We're over by 10 already?
Yeah.
Oh, good.
That's okay. Just.
So this.
Service area. B-Hop. So this is another home ownership program, back to getting people to live locally. If you're an employee at Bronson, we will give you $10,000 to buy a home in a few of the core neighborhoods.
Wow.
Yeah,
There's me at my home.
it's the very short version of that story. Sorry, I thought we were going till 10:50.
Yep.
That'd be a good incentive for renting it, or just.
Yeah. So we're looking to progress that more and more. That's another housing development. It's gonna be.
Yeah, the housing development is something that it's a private organization looking to build affordable housing in close proximity to the hospital. And they've asked us, that's another role that anchor institutions can play, like signing letters of support so they can take it to the bank and say, we're going to encourage our employees to live here so that you can be assured of rents and things like that. That's a part of our goal to have, what do we say, 500 people living within half a mile in 5 years or something like that?